Located in Central America is the Republic of Guatemala. A mountainous region with multiple active volcanoes, Guatemala is home to over 13 million people. As a developing nation, Guatemalans still face many issues within the country, such as unclean water and pollution. But the most significant problem, by far, is the rampant poverty, especially in rural communities. Over 75% of the population lives below the poverty line, and the government has been unable to invest substantial funds into education, nutrition, and health. Many people live with easily preventable diseases or complications because of malnutrition, issues which are rarely present in more advanced countries such as the United States.
En mi opinión, en Guatemala muy bajo,
¿Sí?
muy bajo por la economía, ¿verdad? Por la economía no hay mucha medicina.
Hay muchas enfermedades.
Sí.
La mera verdad de Guatemala no trabajan como que si, por ejemplo, cáncer, más que todo hay mucha cáncer.
La familia es muy grande y necesitamos apoyo para médicos, tratamientos.
Hay diarreas, hay de muchas enfermedades.
El problema es que no hay trabajo, no hay mucho trabajo para poder dar lo que la familia necesita.
Muchas cosas más que se necesita en nuestro pueblo.
Y espero Dios que sí, sigan adelante con eso.
To provide free medical relief to impoverished Guatemalans, the global nonprofit organization Humanity First began hosting medical camps through its Gift of Health program.
We established Humanity First Guatemala in 2010. The last year we started with Gift of Health. And with these camps, we are doing to see the common illness in the people, to get a better picture. And with these numbers, we will see where is the most the problems with kids or adults in these areas that we are doing these camps.
In 2013, a team of 14 American volunteers journeyed to Guatemala on a mission to provide free medical relief starting December 18th and ending on the 24th. They are aided by numerous Guatemalan staff and translators. The medical camp is set up in Santo Domingo Zenacoj, located about half an hour from the major city of Antigua. There are 3 sections to the camp: the reception, the clinic, and the pharmacy. At the reception, patients wait to be registered and are treated to hot tea and bread. Patients then get their blood pressure and percent oxygen saturation taken next to the reception area, after which they move on to the main clinic. There are 4 subdivisions in the clinic. Each has a doctor and a translator. The doctors first give each patient a quick checkup, then address any health issues for which the patients have come to resolve. When they are finished, the doctors write up a prescription, and the patients move to the pharmacy. There, patients receive their medications, along with simple hygiene packs. Work in the pharmacy consists of counting up pills, writing up labels, packaging and pre-packaging, and using the nebulizer, a machine to ease asthma symptoms. In addition to providing medications, a few of the volunteers work more with the children at the clinic.
I am a first grade teacher back in the States, and so I've come here to help out and volunteer and do what I can, but I have a special interest in interacting and giving gifts to the children. I did a toy drive back at home in New York in my school, and the students brought in hundreds of toys, which we brought down to Guatemala, and I'm here handing them out, taking some pictures with them to bring back to my students. So we have a little connection, New York to Guatemala.
By the second day, the number of patients is dwindling, and an executive decision is made to move to a new location where it is estimated that over 1,000 people will visit the clinic in one day alone. As the last Gift of Health clinic earlier in the year saw 2,600 patients, the volunteers are eager to surpass the standing record, and they quickly get to work packing up equipment and pre-packaging pills to move to the new site.
We are now in Alotenago. We moved from Santo Domingo, Chinacro, to this place because We want to serve more people. This is a big city, 35,000 people, a lot of poverty around. And alhamdulillah, we have the support of the mayor of the city, and they provide us this facility and to have a good support to do our camp. For that reason, we moved from the other place to this to try to and to start a relationship with this mayor too to next camps.
On the first day, there is already a line stretching from the reception desk to out around the building. The new camp is set up similar to the first one. There is a reception area and a large waiting area. Vital signs are still being taken, and the clinic is now comprised of individual rooms. The pharmacy is busier than ever trying to keep up the packaging and labeling as more and more patients pour in for their prescription. The camp in Alotenango is open for 2 days, and in that time span, over 1,200 patients are seen.
We just broke the record. I think we got 2,910 patients in 5 days. And I mean, it feels great. We weren't expecting to break the record, but we did. So it's great.
On the final day, after the last patient had been seen, the people who had received treatment on that day gather for a final farewell program. The city mayor personally graced the event and handed out certificates to each volunteer. After all of the hard work by the Humanity First team, the gratefulness of the Guatemalan people for the aid they had received was gratifying.